Now we're trying so hard to refresh our anatomy knowledge, okay, things we learned in anatomy. So I'm trying to refresh the knowledge because we're about to start how will I put it, we're about to start applying them in obstetrics and gynecology. Okay, so this is the pelvic outlet. So we'll talk about the anatomy of the pelvic outlet. Okay, so in the pelvis, the front side is the inlet, the outside is the outlet. So what are the peculiar features of the outlet of the pelvis? Okay, so pelvic outlet, we say that is the lower opening of the true pelvis. It's very important in childbirth because it forms the final passageway through which the baby will go. Okay, if the baby wants to now get expelled from the uterus. Okay, so this is the inlet from inside, the outlet is the outside. Okay, so boundaries of the pelvic outlet: anteriorly we have the pubic symphysis and the inferior pubic rami. Okay, so this is the pubic symphysis. Okay, ischial pubic ramus. Okay, laterally we have the ischial tuberosities. Ischial tuberosities should be here. Okay, laterally. Then posterolaterally we have the sacrotuberous ligament. This is sacrotuberous ligament. Posterolateral at the back but away from the midline. Okay, then posterior inferiorly we have the coccyx. If you look down, okay, so this is the coccyx. Okay, so down at the back, okay, you have the coccyx. Okay, so key dimensions: if you want to measure the diameters, you use what? The anterior posterior diameter. That's from the pubic symphysis to the coccyx. For a normal pelvis for a woman, all right, should be 11.5. Transverse diameter, that's from this ischial tuberosity to this ischial tuberosity, it should be 11 centimeters. So these measurements are very important to know whether a woman can be able to give birth to the baby through the vagina or not. So the outlet is closed by pelvic floor muscles like the levator ani, the coccygeus. Okay, and is divided into the urogenital triangle and the anal triangle. Those ones, we'll talk about them when we're talking about anatomy. Okay, so that's it for the anatomy of the pelvic outlet.